Hello, everyone. My name is Maggie Benecamper. I'm doing my project with Kelly Clemens, Dr. Matthew Tall, and Dr. Andrew Gears at the University of Toledo. So we're doing our study on perceptions of open-label placebos for anxiety treatment, specifically how social feedback influences beliefs. A little bit of background for our study. Research provides substantial evidence of the psychophysiological effects of placebos as either alternatives for or supplements to pharmacological treatment. The deception required in traditional placebo effect studies, however, is unethical as it violates patient trust and autonomy. Researchers have recently begun to study the effects of open-label placebos, which are placebos administered without deception. But presently, there is a gap in open-label placebo research regarding the potential for open-label placebos in treating anxiety disorders, and it is unclear how patients and practitioners will respond to the idea of open-label placebos for anxiety treatment. So the present study focuses on perceptions of open-label placebos for treating anxiety, and this is through the manipulation of social information about expectations and outcomes of an open-label placebo treatment for anxiety. Persuasion research finds that large discrepancies between expectations and outcomes influence judgment. And building from this work, we hypothesize that expecting open-label placebos to be ineffective, but then finding them to be effective, will lead to the most positive perceptions of open-label placebos. And then conversely, expecting open-label placebos to be effective, but then finding them to be ineffective will lead to the most negative perceptions of open-label placebos. So our main research question is, how does social feedback about an open-label placebo alter perceptions about the efficacy of open-label placebos for treating anxiety? Our hypotheses are divided into two main hypotheses with also two adjacent hypotheses. So participants who view the negative expectation, this is our first main hypothesis. Hypothesis. Participants who view the negative expectation positive outcome message will have the most positive view of open label placebos. And then with that hypothesis, we have participants who view the positive expectation positive outcome message will have a positive view of open label placebos, but not as positive as participants who view the negative expectation positive outcome message. And then our second main hypothesis is that participants who view the positive expectation negative outcome message will have the most negative view of open label placebos. And with that, participants who view the negative expectation negative outcome message will have a negative view of open label placebos, but not as negative as participants who view the positive expectation negative outcome message. So our methodology. This is a 2x2 between subjects factorial study design. Our participants are going to be adults reporting a diagnosed anxiety disorder who are currently taking medication to treat their anxiety. So all participants are going to be given basic information about open label placebos, and then from there be split off into 5 groups, which will be our independent variables, including a no message control group. So we're going to talk about our independent variables here. So our manipulation will be social feedback videos about expectations, either positive or negative, and then outcomes, either positive or negative, of open label placebo use for anxiety treatment. As I mentioned, there's going to be 5 groups total, including a no message control group. So the actual manipulation groups will be a positive expectation, negative outcome group, a negative expectation positive outcome group, a positive expectation positive outcome group, and a negative expectation negative outcome group. And then our outcome variables are going to be personal efficacy and expectations. So will open label placebos work for you? And then general efficacy and expectations. So will open label placebos work for the general population? Our specific measures are the Theory of Planned Behavior Questionnaire, the Adapted Modified Differential Emotion Scale, the Adapted Expectation for Treatment Scale, Effectiveness, which is a measure we use in our lab and are working to validate, treatment acceptability scale, approach responses, which is another measure that we use in our lab and are working to validate. And then we're going to be measuring self-enhancement and protection, but specifically the defensiveness subscale, and then the anxiety subscale of the depression, anxiety, and stress scale. So what is the future of open-label placebos as anxiety treatment? What do we expect? Well, because the only medications that truly treat anxiety are addictive, short-term use, psychoactive drugs such as benzodiazepines, open-label placebos can be an alternative for those who cannot take this kind of medication or those who are not comfortable taking medication. So utilizing open-label placebos further has the potential to treat anxiety without the negative side effects that can occur with the use of active medication. Some implications for our study. It invites us to investigate why people have the perceptions they do about open-label placebos, more specifically for treating anxiety. And results of this study will help the healthcare community better understand how social feedback alters perceptions of open-label placebos. And they will additionally indicate the relevance of altering perceptions of open-label placebos for anxiety treatment, as open-label placebos could be an alternative to addictive medication, again, for example, benzodiazepines. Future studies should consider how other social factors, like social identities or perceptions of authority, could impact perceptions of open-label placebos, and then also recruit non-weird samples to increase generalizability. Thank you.